Is it your favorite?
No.
Hey, Debbie, can you hear?
That's cool. It's not charging.
I'm going to pause recording for a second until we have everyone joining, and then I'll resume recording.
Hi, good evening. Thanks for joining us tonight. My name is Debbie Krueger, and I'm a dental hygienist and program consultant with the Children and Youth Branch of the North Carolina Department of Health and Human Services. I have with me tonight my family partner, Allie Luna. Al, would you like to introduce yourself, please?
Yes, hi, I'm Allie. I'm a mom of 4. A few of my children have special needs. I have one on the autism spectrum, one suspected, and then also epilepsy, genetic issues, brain issues, you name it. So a little bit of everything here. And I just want to, thank you for being here tonight. Okay, some of our objectives tonight, we want to share with you the importance of oral health, especially for kids with special needs, ways that families can partner with the providers. We really want you to feel at home with your dental home. Dental home is going to be where you go for a majority of your care, preventative care, things of that nature. And, really, you want to be able to be comfortable there. It's going to make life easier for you, for your child, everybody. We also want to go through some accommodations and strategies that can be applied in that setting. That way things go smooth. So often we have healthcare fatigue, whether it be just because of different medical exams, appointments here, the busyness with life. But, really it's important that we focus on oral health, and you'll soon see why. But it's important that we don't really get that fatigue, that medical fatigue that comes into play, and just really having a solid foundation with a great provider and a good relationship will help in that area. Okay. Did you know that although largely preventable, tooth decay, cavities is the most common chronic disease in children and youth ages 6 to 19 years? They're actually 5 times more prevalent than asthma. So, that's kind of some insight. Asthma is so popular now. It's 5 times more common. So we really want to be sure that we take care of those teeth.
We said before that tooth decay is largely preventable, and we've got some tools that we'll talk a little bit about tonight to help you prevent tooth decay and other diseases in your child's mouth. Fluorides are a great tool to prevent tooth decay, as well as sealants. Sealants are a clear plastic coating that we paint on the chewing surfaces of the back teeth to help them not get decay. Hygiene refers to you brushing your child's teeth. A child should have his teeth brushed for 2 minutes twice a day. And you may think that your child is doing a great job brushing, but science says they probably aren't. So you need to follow up behind them. We also want you to be aware of your child's nutrition. Try to limit sugary drinks and snacks. And of course, regular checkups are so important so we can catch any disease before it gets too far along. One of the goals of tonight's program is to stress to you the importance of a dental home for your child. And we would hope that that dental home is close to your home. Just like you have a physician who is your doctor, we hope you also will have a dentist who is your dentist. The American Academy of Pediatric Dentistry, the American Academy of Pediatrics, the American Dental Association all recommend that children have a dental home by age 1. Now, just like your dentist who treats you may refer you out for other things like crowns or bridges or orthodontics, or an oral surgeon perhaps for extraction, your dental home may refer your child out for more specialized services, but we want you to have that dental home so that you'll have someone who can refer you out if you need it. When we talk about oral health, we're talking about more than just teeth. Believe it or not, if your child's teeth are crowded or misplaced, that is a hindrance and doesn't help your child have good oral health. Gums are just as important as teeth. Your child's gums should not bleed when you brush their teeth or when they brush their teeth. Teeth are also important in terms of speaking, in terms of self-esteem, and we know that they are a link to other diseases like pneumonia, arthritis, systemic diseases like heart disease, strokes, liver disease, and obesity even.
Okay, so we spoke how, children with special healthcare needs, they also sometimes have special oral health needs. They're almost twice as likely to have unmet dental problems. And again, sometimes that goes with their condition, their diagnosis, if they have some vitamin deficiencies, if they're on some certain medications, but sometimes it just has to do with that medical fatigue. If we have to prioritize our appointments, sometimes the other ones we feel as parents like, well, we have to get in that one. We don't have to get in for the dental. But you know what? Really, we really do. Knowing a child's needs can make the dental visit easier for the family and the dentist. And so that's why this presentation is really important, because that way we can identify what needs you can identify. That way things will go smoothly. Oral health can often take a back seat, right? That one we spoke about.
For a long time, there was no requirement in dental school, dental hygiene programs, or dental assisting programs that those students have any sort of education in providing care to special needs patients. I'm very excited to tell you that effective July 1st, that changed in the United States, but your local dentist may not have had that training if they didn't graduate just this year. So we also offer a course for your local dentist, because we want your local dentist to be comfortable and we want you to be comfortable being there. Every dental patient in the United States deserves the same quality of dental care regardless of whether or not they have a disability. That's the policy of the National Council on Disability and the American Dental Association. As I mentioned before, there are a lot of impacts from poor oral health. The most common one is pain. Nobody wants their child to be in pain, but they may not be able to tell you that they're in pain. If they can't eat well, they're not going to be healthy and they're not going to have good speech development. If they don't sleep well, they won't do well in school. And they may not develop friendships because they may be embarrassed and have self-esteem or even behavior issues. I worked as a public health dental hygienist in the schools for decades, and I can tell you, I have seen children sitting in the hall, and when I went to talk to them, I would notice that they had severe dental issues. So maybe their acting up isn't due to behavior. It might be due to a health problem. And if they can't focus in school, they're going to miss the academics, and they can get other problems, as we mentioned before, because of it. And let's face it, it's not cheap to get these problems taken care of. It's much less expensive to prevent it. And we don't want you to have to miss work because you have to go to the dentist for multiple visits. Because special needs children may have a lot of issues that would impact their oral health. Some may have self-injurious behavior. Some may chew on things that perhaps they shouldn't, and it breaks their teeth. They may have problems with gait or balance and have injuries. They take lots of medications, and most of those medications have side effects. And if they have side effects, they may not be able to eat well. Even if your child does not eat by mouth, they still need to see the dentist a minimum of twice a year. Tube-fed children actually tend to have more dental problems than children who eat through their mouth.
So now we're going to get into the portion where we have the opportunities for accommodations. You know, sometimes when we hear the word accommodations, we may think of a school setting or a housing setting, but, you know, really, they also do dental home. With COVID protocols and extra sanitation, some of these accommodations we discuss may not be possible, but they're still worth exploring and discussing with your dentist to see how you can work it out. Okay, so right here we have the dental home checklist, which is an amazing document put together in cooperation with professionals and parents. It's in both sides, and it discusses both views on it. You know, there are some categories here. They're comprised of anxiety, communication, sensory, and mobility issues. Now, it may not apply to you. You'll have to go through to see which fits your family and which doesn't. But it's not used to create a grading system, but rather just kind of a starting point as a guidance for you when you're choosing a dental home.
You don't have to have a child with special health care needs to experience anxiety going to the dental office. It's one of the most common issues that we hear about. But let's talk about a couple of the items on the checklist that do address anxiety. One of the things to ask when you call to make the initial appointment would be, does that dental office have flexibility in its scheduling so that your child and you become familiar with the staff? You're always more comfortable with things that you know about. This, during COVID, may not get the answer that you would like to have, and that may be understandable. So don't let that be a make or break question. Also, many children are not very flexible in their schedule and routine. Be sure to ask when you call to make the appointment if they can accommodate your child's special routine. And you should be able to remain in the operatory with your child. Now, I will tell you that during COVID, the recommendation from the Centers for Disease Control is only one person to accompany the child. So if you have another child that you usually take with you, you need to make arrangements before you arrive at the dental office, or they may have to reschedule you. You also will need to wear a mask when you go back with child, and you'll need to keep that mask on during the entire appointment. Many children like to bring a blanket or a toy with them. You might want to go ahead and ask when you call and make the appointment if that's possible. Again, this is one of those times when COVID may present a problem. The COVID virus is in the air. And if your child takes in a blanket, that blanket will be exposed to the COVID virus that's in the air in that office. So you might want to take a garbage bag to put the blanket in when you leave the office so you can wash it when you get home. Or the same might be true of a stuffed animal. If the office has more than one room, very often your child will feel comfortable if you can ask if the child can use that same room for every appointment. That consistency and routine may help them not to feel so nervous and help them to be a better cooperating patient with the dental staff. can they allow enough time when they schedule your appointment so that your child can get comfortable and used to the surroundings before work actually commences? These are all just some questions that you might want to ask when you address making the first appointment. There are a couple of others on the questionnaire that address anxiety. Do they have special ways to talk with you about interacting with a child? This is extremely important. The dental staff knows everything about the dentistry, but you know everything about your child. And you can explain to them things that your child may have a hang up about or things that they get really excited about. Another clue to addressing that anxiety is if they invite you to ask questions about them, because you want to know everything before you arrive to avoid any confrontation and anxiety when the dental appointment actually happens.
Some additional anxiety strategies. During the first visit, the dental provider may ask you or your child about things that you like. Maybe make a note before you come home, or even if you complete your paperwork and send it on over before your appointment, you may want to make a note on there, just kind of add an asterisk. And, my child loves Disney princesses. My child loves dinosaurs. Because sometimes the provider can work that into the visit, and it really helps put the child at ease. It's something that's familiar, it's something that's enjoyable, and hopefully it'll just, make things go by a little bit easier. We have here, allow a child to watch a family member's dental visit. Again, now in COVID times, unfortunately, it's less likely that that's a possibility. But one thing that you can do is maybe when you go in for a dental visit, ask your dentist, hey, can I take a picture real quick? Can we take a picture so my child can see how brave I am at the dentist? And then you can go home and show your child, hey, look, mom, dad, grandma, grandpa, auntie, whoever you may be, look at me at the dentist. And it really will help the child have that connection. You want to be sure if a child asks a question that you honor it, and you want to build trust. You don't want to lie to them. If they're scared, to just try to be there by their side. Don't tell them, this will hurt, this won't hurt. You don't want to get into any of that. You just really want to be there. Some things you might consider, instead of saying, which chair do you want to sit in? I mean, you would want to say that, I'm sorry, opposed to, can you sit in the chair, or would you sit in this chair? Don't give them the opportunity to say no, because you want to honor their opinion. So then what do you do if they won't sit in the chair? You don't want to use words that could be upsetting. You don't want to say hurt, drill, things of that nature, things that may really impress upon them to be scary. We also would like you to consider maybe having a code word or phrase if the dentist has something that you think possibly your child could not handle hearing. I know personally we don't have a code, my dentist and I, but I kind of give like a little nudge or a little wink, and that gets the point across. And so sometimes we'll step out without even my child noticing, and we'll discuss the treatment or what have you. Also, emotional support animals if the office allows. Again, this is one of those things that really not all offices will allow it, even before COVID, but especially after. But it is worth asking about. Keep in mind, there is a difference between emotional support animals and service animals. So we'll get into that a little bit later. Additional strategies, visuals or a visual schedule. I know when we go to the dentist, now we go over what we're going to go through. First, we're going to sit in the chair, then we're going to get our teeth cleaned, then we're going to get our prize. We really do it, and that way it's familiar and helpful. Again, you want to keep away from words like drill, but you want to maybe tickle, flutter, clean. You always want to say what you mean, especially, you know, with the dentist. Sometimes they may joke and say something like, I'm going to take you home with me. But they may not realize that your child is a very literal child and really be scared that they're going to take them home. So then maybe you want to intervene and say, oh, the dentist is just kidding, you know, and really help put your child at ease a little bit more. And then you can also ask the provider to speak in a manner that is comfortable for your child. You know your child best. You are the professional of your child. So as far as speed, volume, some kids, you know, really connect well to over animated, you know, personalities. Some kids don't. I'll never forget one time I brought my son to the doctor, and he was little, and so the doctor adjusted his own voice and his demeanor for my son, and he talked like, you know, you would expect a doctor to speak to a child. And my son left there and he said, oh, that doctor is so condescending, I never want to go back. And, you know, it kind of took me back, him saying condescending, but really that's his personality. And so it wasn't a great fit. And so had I known this back then, I maybe would have stepped aside and said, hey, you know, you can speak to him in the manner of X, Y, and Z. So
Another field that's addressed in the checklist is communication, and communication is really the key foundation for having a good relationship with your child's dentist. When you call again to make that appointment, if there's any paperwork that needs to be done, make arrangements to do all that paperwork ahead of time, whether it's health history or financial information or anything that can be done ahead of time. You're much better off doing it ahead of time, and make sure that they're going to be able to provide you with that communication ahead of time. Also, let the office know if your child needs help communicating. Your child may have a hearing issue or may have a speech issue. That office needs to know if they need to provide an interpreter or some sort of chalkboard that your child can write on, and that all needs to be communicated ahead of time. If there are instructions, make sure that they are instructions that you understand. Usually they'll mail you a new patient package, and make sure that you understand all the communication that they're sending to you, because after all, communication means information going in two directions.
Some additional communication strategies in the deaf and hearing loss population. You know, sometimes they utilize a TV room, a TV in the room on the ceiling. Others will have it on the wall. Often they use it to keep the kids distracted, but you know, you may want to consider if they have the ability to use it for communication as well. Pictures, other visuals, PECs, things like that. You want to reduce and eliminate the ambient and high-pitched noise, especially for children with cochlear implants or hearing aids. You know, sometimes a lot of that feedback gets picked up and you may not realize it, and the dental provider may not realize it, but your child is hearing it and you know, feeling it, and it just kind of creates an anxiety feeling. You want to use an iPad, tablet, handheld whiteboard, paper, pencil, whatever you use on a typical basis. You may want to bring it in, especially with COVID. So that way you may not have to touch their instruments and possibly, you know, have more of a contamination issue. Goodness forbid if there's something there. When speech is affected, you want to inform the provider ahead of time. You know, if you'll need a interpreter or things of that nature. You may want to use a visual pain scale with pictures. Sometimes it's a smiley face, sometimes it's numbers, but that may be helpful. You can use a model of teeth to ask and answer questions, often, especially the pediatric dental practices, they'll have a puppet with big teeth and a big toothbrush and things of that nature. You know, don't be afraid to ask the provider if they have one. And so maybe you can show your child and it'll be easier. And again, that iPad, tablet, paper, pen, if you have one, bring it. That would be a great idea.
This is a mask that I really love. It's designed by a lady who had a hearing loss because she needed to read lips. And she couldn't understand what the dental staff was saying to her because of the mask. I think this is a great mask for anybody, whether you have hearing loss or not, because who can't respond to a smile? We already talked about how we tend to have a lot of anxiety. And with this mask, it's got a clear plastic window so that if you need to read lips, you can. But if you see somebody smiling at you, it just tends to make you relax. This mask, sadly, does not satisfy the requirements now for COVID for the dental provider to wear. But like we said, you're going to have to wear a mask when you go in with your child. And this would be great for you to have to wear with your child when you go in with them so that they can see that you're smiling and everything's okay and they can relax a little bit.
Also, if I could add, Debbie, with that great communicator mask, I know sometimes PPE can be hard to find in this day and age. But there are some really great free templates for people that sew, or maybe you have a friend that sews or whatever. You can commission the seamstress, and there's some free templates that you can use to create fabric masks with that same, opening that you can see your face. And so if you Google it, a whole bunch will come up and it's wonderful. Additional communication strategies. Request ways to communicate information privately, whether it be on the form, a phone call, and that, again, that code phrase or word or little wink or nudge, just to kind of communicate and get across with your provider, you know, things that may be upsetting to your child.
Another area that's addressed on our checklist are sensory concerns. Very often children who have special health care needs are very sensitive to outside things. Distractions are huge. When you call to make that appointment, ask if your child can have their examination in a private room where there aren't children around who may be crying or making noise or other disturbances to keep them from being able to concentrate. Do they have behavioral support in case your child starts to act up or has trouble sitting still? A lot of offices are still using a papoose board for children. You should know that if they recommend a papoose board for you, you have to sign what's called an informed consent. And there are other options, and we're going to talk about other tools that we can use. Sometimes children have to go to the operating room and have general anesthesia, but there are other treatment modalities that you can use to help your child with their behavioral problems.
Some additional strategies and tools for sensory concerns. If your child has a light sensitivity, you may want to consider sunglasses, a dental light cover. Often they have those things on hands, but especially sunglasses, you may want to bring your own just to make sure that they're nice and clean on your face. But they'll also feel familiar to your child, which may help things. You may want to ask them to use a handheld flashlight versus the overhead light, a lamp light or natural light versus the fluorescent light. Especially my epileptic child, she doesn't have a light sensitivity in terms of the sensory aspect, but they do bring on headaches and auras of seizures for her. So, we try to ask for a natural light by the window, and it's usually never an issue. If we can, avoid changes in light without warning. If you see the provider is going to turn down the lights to show you an x-ray or whatever it may be, maybe you can give the verbal cue, hey, all right, we're going to turn out the lights now. And it may just help your child that little bit to feel a little bit more comfortable in the chair. Okay, additional strategies, again, sensory. If your child has an auditory sensitivity, you may want to, keep the main waiting area calm, low noise. Often now that's not an issue with COVID. They like to keep the waiting room, really quiet as possible, not many people. But also, you may want to wait in your car and have them call you or things of that nature. Sound machines are a great option. There are some apps on the phone you can download that have white noise or a bubbling brook or whatever it may be. And that's a great option. If you know your child, if you need a low voice, go for it. Noise canceling headphones, if that's something you usually use, that could be a great thing. Play music either with or without headphones. Some already play the music, but you can also ask them to turn it down. I know my son does not like loud noises, and whenever we go, if we're in a private exam room, he asks, hey, can you turn that off? And they always accommodate him. So really, don't be afraid to speak up on behalf of your child to see if it's something that can happen. And also, you may want to ask the dental provider to give warnings before using noisy instruments, and be careful how they describe them. Sometimes things may be innocent, drill, right? But we want to keep away from that word. Another thing that might be great is, letting the child feel it on their hand before putting it into their mouth. And just that way the child can feel more comfortable, because that's the goal. The more comfortable they are, the more pleasant the visit will be. Okay. Again, sensory concerns, we have sensitivity to touch here. You may want to give warning or ask permission to touch their body and honor their answer. That's a great practice wherever you may go, not only in a dental setting. You may want to let them know what you're doing and why. We're going to put this bib on, and this bib is to keep, things from getting all over your clothes or what have you, and cleaning teeth, just the process of it. Some kids really appreciate that. Other kids don't want to know. So don't be afraid to ask your child what they want, and if they can communicate with you what they want, or if you could read their body language, you can help your provider really help meet their needs. Now, you also using familiar and pleasant words. We spoke about that before. Flutter and tickle, smooth and clean are some other great words. And you can also ask if they'd like to feel the tools, hands, arms, or sometimes hearing the buzzing next to their ear, whatever it may be. Sometimes you can even bring some of the tools home. If it's like sometimes the providers will keep a little mirror or flossing, and you can ask if you can bring them home. You may want to ask off to the side as to not disappoint your child if they don't have one. Some additional strategies: fidgets, squishies, weighted blankets, compression vests, exercise bands. Again, especially with COVID, sometimes the protocols will not allow, but you can ask. And you can ask, if there's a way that we can make it work. One mom mentioned her child always bring a weighted blanket, and they said you can't bring it in because in case there's anything airborne, you can't go home with it. And they came to the idea of, let's put it in a trash bag and use it that way, then take off the trash bag, and that way it's not contaminated. And that worked out wonderfully. So things that are easy to wipe down, fidgets, squishies, a lot of them you can wipe down quick with Lysol or what have you. Okay, we move on to additional strategies and tools with sensory concerns. movement and balance sensitivities. You can ask if they would like to be put in the chair before it goes back, or if they want to stand back and watch the chair go back and then get into that reclined position. Some children may not like the feeling of going back and not being able to see behind them. And it may not be something that they think to voice, but it really can kind of upset the flow of things and make them a little bit nervous. So you want to pay attention to that. You can, if they're really afraid of the seat, you can offer maybe, you can ask the provider if they can offer alternative seating options. Is it okay if my child sits in my lap? I will tell you that we did that with one of my children. She did not want to get into the dental chair. So what we did was we started with her on my lap in the chair off to the side. Then after a few minutes and she was comfortable, then her and I both sat in a dental chair. She sat in my lap. And I tell you, a couple times of that, by no time, she was comfortable in that chair. Now she gets in there like a boss, and she loves going to the dentist, and she's completely independent in sitting. So, don't be afraid. Don't be discouraged. Sometimes it's hard to get on yourself as a parent, like, oh, this is, my child. It happens. It happens a lot. And really, with good partnership, get through it.
There are other things that can be done to address sensitivity. Ask your dentist if they have flavorless products. The paste that they use when they polish or clean your teeth with the handpiece has variations that are flavorless and that are also don't have that gritty feeling. That's great, particularly for children who are on the autism spectrum. Cotton rolls are something else that seem to trigger children with sensitivity issues. Sadly, because we have to keep a dry field, we pretty much have to use them a lot of the time. One of the things that I do when I'm working on children, whether they have special needs or not, is to go ahead and hand them a cotton roll, let them play with it in their hand while I'm getting ready, so that when I do put it in their mouth, it doesn't feel so strange because they've been used to playing with one. Of course, I don't put the one they've been playing with in their mouth, but a different one that looks just like it. Give them an option to rinse with water from a cup. We're trying to reduce aerosols or things that become embedded in the air in the dental office. So this is a great option for two reasons. One is that many children don't like the water syringe squirted in their mouth. This way, they're used to drinking from a cup. Let them go ahead and drink from a cup. It solves the aerosol problem and it keeps the child happy. The same goes in reverse. Let them spit into a different cup instead of running the loud suction that may scare a lot of children. When you call to make the appointment, also ask if they use air fresheners or any sort of scented, and if their employees wear colognes that may irritate your child and make it to be an unhappy appointment for them. On the checklist, if you'll look at it, there's also items that address mobility concerns, and we're going to talk about that for a little bit now. Is the office accessible? I know that most offices now do have a ramp, but being accessible means more than just having a ramp. If they have a very steep driveway, you may have trouble with getting your child out of your vehicle and yet getting a wheelchair into the office safely because of the steep hill. Make sure you address any kind of issues that may come along. Perhaps they have a gravel parking lot that would be difficult to navigate a wheelchair on. Does the exam room have enough room that your wheelchair can get into and let the child transfer from the wheelchair to the chair? This is particularly important if you go to a pediatric dentist where they may have a large room with lots of chairs in it, and there may not be enough room between the chairs to accommodate a wheelchair, or if they're in a private exam room, that private exam room may not be large enough to accommodate a wheelchair. So these are just some mobility concerns that you can ask about, again, when you call to make the appointment, so you won't go through all the anxiety of arriving and finding out that your child can't navigate the office effectively.
Some additional strategies for mobility and neuromuscular concerns. Again, you know, it's all about really helping the child feel comfortable. Sometimes it may be beneficial to allow the child to remain in their mobility chair. You know, it avoids the stress of the transfer. A lot of them can recline and have that same angle that a dental chair would, which also makes it a great option, along with the harnesses and other straps that keep them secure on a regular basis, whereas the dental chair may not. You know, this could be really a great solution. You know, that way they don't have to ask about using a papoose or things of that nature. It's comfortable, it's familiar. You know, when it comes to COVID-19, you know, there's just a lot of different sanitation protocols in place. But really you can ask if you want your child to remain in the chair. And sometimes it's a matter, you know, of asking the right person. Maybe at the front desk, you know, they're used to saying no. Check with the provider, say, hey, maybe next time, can we try the chair, and see what the provider says, and you know, it may be a great solution. You know, you really want to read what you're signing when it comes to use of restraint, such as the papoose. So anything we can do to try to avoid that. I mean, sometimes it is necessary, but sometimes it could be anxiety inducing. So we just want to, you know, reduce the chance of that if possible. Okay, additional strategies would be the appropriate chair angle. It reduces the risk of aspiration, especially for children that have some swallowing issues, things of that nature. You know, you can compromise between the dentist and the patient, between comfort and necessity. If you see that your child is really struggling, you can ask the provider, hey, can we move it up a bit, a smidge, you know, and as long as it's still a safe option, the provider may be able to do that for you. Items to help with support and stability could be a rolled up towel, a blanket, you know, something to wedge behind their back or on their side. Those are helpful. If you use any at home, maybe you can, you know, kind of scan your brain real quick and say, oh, this will work, you know. Also, a mouth prop that keeps mouths safely open for treatment. I know Debbie always has one on hand, that great mouth prop. Basically, it goes into their mouth and it keeps their mouth open for them. And you know what? It makes it so much easier, not only in the office, but sometimes you can get one at home to brush with as well. And then when you use that at home, they'll be right at home comfortable when they're at the dental office and they're used to using it. Again, rinsing with a cup of water instead of using the syringe on top of, you know, the aerosols and whatnot. It's familiar, it's comfortable, it may work.
This is a mouth rest that I really like, both as a clinician and as a parent. It's soft and yet it's sturdy. You put it into the mouth in the front in a horizontal position, and then you turn it up vertically to the back when you get to the back teeth. Then you can work on the opposite side. The child can keep their mouth open. In fact, I usually tell them that this is a tooth rest or a tooth pillow, and they can just bite down on it, and they can without it breaking. The child is comfortable. They can keep their mouth open. You may remember I told you earlier, you need to brush your child's teeth for at least 2 minutes twice a day. If you've ever tried to hold your own mouth open for 2 minutes, you're a better person than I am. But this helps them to do it at home without a lot of pain or issues with keeping their mouth open so long. And if you use it at home, then when they go to the dental office and they put a mouth prop in their mouth, it's not so terrifying to the child. This particular one is called an open wide, and you can put it in the dishwasher between uses. I recommend, though, that you have one for each child and that you just put it in the dishwasher between that child. Don't put it in the dishwasher between Tom and then Sally. But this is a great tool, and we're going to give you some resources for where you can find some of these tools, like the mouth prop and the mask that shows your mouth a little later in the program. Also, if you look on your checklist, a couple of other items. Number one is very obvious for very obvious reasons, particularly now with COVID and so many people have been laid off. Make sure that they accept your dental insurance. Not all dental offices accept Medicaid. The fact that you have Medicaid doesn't mean that the dentist has to accept it. It may be that you've lost your job and you no longer have dental insurance. So you need to check about what the options are for self-pay. Or maybe you've gotten a new job since you lost your last one with COVID, and it's a different insurance, and perhaps that office doesn't accept that insurance. So that's something to clear up right away. Another really important option is if that office covers their patients on weekends and in the evening. Special needs patients are more prone to accidents. If your child falls off the monkey bars on a Saturday morning, can you call that office and will they provide someone to take care of your child? That's why we like to call it a dental home. Just like when we as adults are out and something comes up we're not expecting, we call home for help. Your dental home, who is the dentist who's close to you, it's important that they're willing to see your child at night. Perhaps you pick them up at daycare and they've got a toothache and it's 6 o'clock. What do you do then? So that's a very important. In fact, we're covering these two last, but they may be two of the most important questions that you need to ask when you're making that appointment. We said that we want you to take your child to the dentist before they turn 1, and that's for a couple of reasons. One, that we can check any problems before they develop, but 2, it helps them to be comfortable and reduces that anxiety that we talked about. We want to make sure with so many medications that they're on that they don't have a condition that we call dry mouth. Saliva or spit in your mouth is actually good for your mouth. It helps to neutralize the acids that are in your mouth from eating and the foods that we eat. And it also helps to control bacteria in the mouth as well. So there are a lot of things. Now, if your child is over 1 and you don't have a dental home yet, do not panic. I will guarantee you are not alone. It's like when you go to try on a bathing suit and you think, oh, I look terrible, and you walk out on the beach. Number 1, nobody looks at you. And number 2, everybody else probably looks worse than you do. Go ahead and make an appointment for your child now and establish a dental home now. You've had a lot on your plate dealing with therapists and medical appointments and health histories and medication. So nobody's going to judge you for not having taken your child to the dentist by age 1, but it's important to go ahead and catch up now. There are some resources. Remember, I told you that we'd give you some ideas. And Allie, I'm going to let you start out covering the resources.
Okay. Well, first here we have the NCDHHS Children and Youth with Special Healthcare Needs Helpline. We have their 1-800 number. We have their email address. Let me tell you, this helpline is fantastic. Not only when it comes to but also with anything special healthcare needs related. Nikki's over there at the helpline, and she's just the sweetest, most understanding person, and she can help you locate things for your children, whether it be, resources or providers. And you know what? On the off chance that she doesn't have the information in her back pocket, she will get it for you, or she will point you in the direction of somebody that can help you. She is fantastic. Okay, we also have the website, and the website is phenomenal. I cannot say enough great things. Even myself, sometimes when I find myself having an extra few minutes, here and there, whether I'm waiting in the car line for pickup, parked, I keep it bookmarked. And I may not have the opportunity to get through it all since there is so much information. But keep it bookmarked. You never know when you may need it. There's information about diagnosis and insurance and family support, just so many great things. There's advocacy resources, transition resources. You will not be disappointed, and it will keep you busy, but it's perfect. Tons of great information, not only with dental, but just all around special healthcare needs related. Our dental home checklist, you'll be provided with a copy of this. That way you can print it out and go through it, or even if you don't have a printer, you can scroll through one by one and make a notation. Again, keep in mind, not every category may apply to you, but you go through and you see what you need and what really matters to you.
Another great resource is the state provides every county with a public health dental hygienist. And Rowan County does have one. It used to be me, but I'm retired now. But those public health hygienists know their community. If you can get in touch with your public health dental hygienist, then she can tell you who in the county will accept Medicaid. She also likely will have information about which dentists are particularly good with children, or which dentists are particularly good with children who may have special needs or may have a special needs child in their own family. The oral health section, which is the North Carolina Department of Public Health's dental department, has a lot of good information too. I would really encourage you to go to a website called toothtalk.org. Toothtalk.org. One of the videos that they have on there I really want you to pay close attention to is on silver diamine fluoride. We're going to talk about that in a minute, but it is really good and a good alternative if you have a child who may be less than cooperative in the dental office. Some other resources, of course, you can Google teeth or oral health, and you'll come up with a lot of different hits. These are three more that we think are particularly good. Just like anything on the internet, you can get good information and bad information. And the notes from this webinar will be available to you so that you don't have to remember all this. If you're like me, once the screen's gone, you've forgotten it. But I've provided a lot of this with Amy, who can get it for you, or you can get in touch with one of us.
Okay, the Americans with Disabilities Act, some of us may be familiar with, some of us may not, but it's a civil rights law that prohibits discrimination against people with disabilities and requires full and equal access. And like Debbie said before, that means more than just parking spots and ramps. It really extends to lots of accommodations. Most children with special needs are protected under the ADA. And as a public accommodation, dental offices are also covered by the ADA. They must really provide the accommodations and whatnot, so that way your child can have access. That was something new that I learned. I honestly never knew that before this. So that really is great to keep in mind. You may require modifications to policies and procedures, changes to the physical environment, effective communication, things that we discussed before, but it does fall within the Americans with Disabilities Act. That also can include training. You can ask the providers if they've had training. You can refer them to the professional version of this training as well. Some really great ADA websites, the ADA National Network. They have lots of information there that's extremely helpful. They have fact sheets on there. They have a searchable database. And it's very family friendly. You know, some websites aren't. Some websites you feel like you have to have a degree in medical lingo, but this really is family friendly and easy to get through. The Department of Justice, they also have fact sheets. They have an info line. If you go on their website, you can find out that number. And if you have to file a complaint, you know, hopefully you never will, but if you do, you can do so on that website as well, www.ada.gov. The United States Access Board, they take ADA standards and they describe them in more detail. That may be something helpful to you. They also offer free webinar series. So that may be something to think about and see what topics they have, if any interest you.
I would also interject here that if your dentist is not familiar with the ADA regulations, we also have a program that's very similar to this where we will come and train the dental office, and we bring along with us Lauren Howard, who's with the Department of Health and Disability, and we educate the office not only on tips and tools, but how these ADA regulations can impact their office as well.
Great, thank you so much, Debbie. Also, service animals and the ADA. I mentioned before the difference between emotional support and service animals. There is a difference. Service animals are defined as dogs and actually some miniature horses that they're trained to perform tasks for people with disabilities. Under the ADA, service animals must be allowed to accompany people in all areas where the public is allowed to go. You must be sure that the animal is under the control of the handler. You know, unfortunately, they can ask if they're not under control. But typically, I think service animals do pretty well in that respect. Unfortunately, emotional support animals do not have the same protections under the ADA. Really, you can still ask if you can bring your emotional support animal, but they do not have the same protections that a service animal would. You know, you have to keep in mind, think of the service animal as a piece of durable medical equipment. That's what one mom said. You know, you need it. It has to be there, and it's part of the accommodations. Okay, some inquiries about service animals. The provider in the office, they may only ask, is this a service animal and what task does it perform? They may not ask about the person's disability, although in a dental setting, they typically already have your file on hand to know, you know, your health history. But they may not require you to provide the documentation for the animal. You cannot be asked to remove the service animal unless the animal is out of control and the handler does not take action, or if the animal is not housebroken. Those are the two times that they can ask you to remove the service animal.
We've talked about some particular products, and we're going to give you a little bit more information about that. One that I really like is silver diamide fluoride. This is a relatively new product. It arrests tooth decay without having to have any kind of numbing or shots or drills or suction or air. You literally dab it on with a tiny, tiny little Q-tip type device, and it's great for children who may not be able to sit still. It arrests the decay. It's not a once and done medicament. It has to be done at least twice a year, sometimes more often, but it's a great alternative. It was just approved for use in 2018, so your dentist may not be familiar with it, so it's worthwhile to ask. And remember that toothtalk.org has a great video about it. Remember we talked about the angle that the little device that they use when they clean your teeth to polish your teeth? There is a brand that doesn't have any paste in it at all. The paste is actually incorporated into the cup, And that's great in fact, I like to have it used on me because there's not all that foam and bubble and grit, and there is no flavor whatsoever. We have resources for the communicator, and Allie told you there are places on the internet if you like to make your own mask, but you can buy them commercially, and we can give you that information. Also, information about the mouth prop, the open wide mouth prop that I described to you earlier that I like so well, both at home and in the office. If you're not familiar with xylitol, xylitol is an artificial sugar that inhibits tooth decay and any kind of irritation of soft tissue, like the gums or the ears or the nose or the lungs or the throat. You find it in lots of chewing gums and mints. There are toothpaste with xylitol. There's xylitol mouth rinse. So that's also a great tool for you to use to help control tooth decay in your child. And there are lots of great teaching aids. One of the teaching aids that you may not have thought of as a teaching aid is actually an electric toothbrush. One of the major electric toothbrush companies now has what's called a smart toothbrush that tells you if your child is spending too much time in one part of the mouth, or if they're pressing too hard, or if they're not pressing hard enough, or if they're brushing not long enough, or I've never seen a child that brushed too long, but I'm sure it would tell you that as well. So we have a lot of good resources we're happy to share with you as well. Something else that we've mentioned are the new considerations now for taking your child to the dentist during the coronavirus. And this is another information sheet that I've given to Amy, but I'm going to show you a couple of the questions now. One of the things, we do want you to take your child to the dentist, and we want you to have your child to have a dental home. But if your child is at high risk, you need to consider the benefit versus the risk. Maybe you need to put it off for a few months. Maybe your insurance has changed because of coronavirus. Maybe the dental office has changed the types of insurance they take since the coronavirus. Again, remember we talked about them letting family members go back to visit, to stay with your child while they're having treatment. Ask what their policy is. Most dental offices now do not have waiting rooms. So you will likely have to arrive ahead of time and wait in your car until the office is ready to see you. That being said, try not to arrive 30 to 45 minutes early if your child doesn't sit in a car well, because they can only see you when they can see you. You will need to wear a mask. Ask if the dental office is going to provide the mask or if you need to bring your own. Again, remember, I recommend the ones so they can see you smiling. Ask the office if they're screening their patients and the people who come with their patients before they enter the dental office. Remember, you're going to be breathing the same air that they are. And how often are they sanitizing and cleaning their offices? How often are they screening their own staff for possible infections? And what kind of personal protective equipment are they going to be wearing? Some offices wear outfits that look like they're going to the moon. Some have not changed their outfits at all. Let that be an indicator to you when you ask how they're protecting themselves. Ask how they're treating their patients and how they're spaced out. We know we don't even want to be within 6 feet in a grocery store with somebody. Are the chairs at least 6 feet apart when your child is receiving treatment for a child that's also receiving treatment? What's going to happen if your child gets upset? Very often, they don't like to treat children who are upset and crying and carrying on, because when they cry, they're expelling a lot of air and perhaps spit and germs into the air. So if your child acts up, they may stop treatment right then. You need to know about that ahead of time and ask them what they'll let you take back. Again, because of COVID, they have a lot of restrictions now about what you can bring back, because you know it's clean and your family knows it's clean, but they're trying to eliminate all sources of bacteria from entering that office that they possibly can. So let's talk a little bit for just a second about some of the things that we've learned tonight. I hope you've learned at least one or two things that you can apply to your child. One of the things is that a child with special health care needs is more susceptible to oral health concerns. 1 in every 5 people has a special health need, and that makes them, because of that special health care needs, more susceptible to tooth decay, to periodontal disease, to accidents with their teeth. There are accommodations that dental practices can make and use to reduce the issues that we've talked about, like anxiety and sensory issues, communications, and mobility needs. We do have resources that are available to support the offices and your family. And we want you to remember that access to a dental home and regular care is just as important as taking your child to the doctor and them having a medical home. Does anybody have any questions now that maybe we can help with?
Thank you, Debbie and Ellie. You guys have done an amazing job and have been so thorough. All the questions that I had in my head at the start and throughout this presentation, you guys have answered beyond what I could even have asked.
Well, great.
So thank you so much for this. And yes, I have those resources available.
Well, if a question should pop up, my email.
Okay.
My email address is on this final slide. If anybody has a question, please feel comfortable to email me and I'll try to help you the best I can. And we would appreciate it if you could complete the training evaluation. It's online. It won't take you but just a little bit. Perhaps you've had an issue in your own family that we didn't address, and we'd like to know that so we can address it for the next family that comes along. Or maybe you found a solution to one of these problems that we hadn't thought of, and you can share it with all of us so we can share it with other families so we can all have better experience both for the dentist and for the children. And I so appreciate your helping with this, Amy, and the parents for having the interest in the child and their child's oral health to participate as well.
Absolutely.
Yes.
Thank you so much.
And I just want to say thank you as well. And if there's one thing that I can really, I can't yell it from the rooftops enough, do not be afraid. If your child is over 1 year old and you have not been to a dental provider, it is okay. Nobody is looking at you in shame. They will be happy that you are there. I know sometimes it could be anxious, and especially maybe you don't have the best teeth, and that was always my case. I felt silly, but I tell you, really, the providers are so helpful. They're there, they want to see your child, and they want to be sure that if they can do preventative care, they do it as soon as possible, or they address any other needs as soon as possible. It really makes a difference. And thank you so much, Amy, for having us tonight.
Yes, absolutely. Thank you guys for lending your expertise and knowledge. I'm going to go ahead and pause the recording, and we will post this both to our YouTube and Facebook page for all to enjoy in the future.
Thank you so much.